In this video, we'll briefly talk about some different careers and career paths in psychology. By the end, you should know the difference between the different types of master's degrees you can get in psychology, a PhD, a PsyD, and an MD, and also the difference between what it means to be in academia versus therapy. Academic settings means that you're at a college or a university. You're still in that academic area. Like I'm an academic. I have not left college. I've been in college since I graduated high school. I got my bachelor's degree, I got my master's degree, I got my PhD, and then I did a postdoc. I was doing research while I was doing that, but I was still in an academic setting, and then I started teaching at the community college level. So in academic settings, you can teach with either a master's or PhD. A master's degree in psychology will take 2 to 3 years beyond a bachelor's degree. I think there are some now that are a little bit more expedited, so sometimes you can get a master's in 1 year. There are a variety of different types of master's degrees in psychology, and we'll talk about some on the next slide. But here we're talking about degrees that just provide you with more in-depth knowledge on psychological topics. So I did a basic master's degrees. I ended up with an MA. I did that because I had done my bachelor's degree. I graduated in 3.5 years. And with that expedited graduation, I kind of changed my mind going into my 4th year about the pathway I wanted to take. So I decided to do a master's and just kind of figure out exactly where I wanted to go and what direction I wanted to go. And so mine didn't give me any type of, lead me to any type of licensing like we'll talk about on the next slide. But with a master's degree, you could teach at a community college, liberal arts colleges, and non-research institutions. So many of my peers from my master's program actually ended up just getting that master's, not going on to any other type of program, not going on in therapy, but just teaching at the community college level for years. The PhD is the type of degree you want if you want to continue on at a research university such as UCLA, UCI, or USC. It'll take at least 4 to 6 years beyond the bachelor's degree, and you'll complete a research dissertation. So what this means is that you are not only taking classes, which is minimal at the PhD level, but you're also doing research in a laboratory. So my research was a little bit different because I was in a neuroscience program, but sometimes you are collecting your own data, sometimes you're data mining and going through data sets, but you're learning about a topic and doing several research projects to build your research dissertation. When you're finished with a PhD in psychology, you are trained as a researcher, and also you're able to practice, be a practicing clinician. Of course, you have to do your licensing, and then there's other obligations that you have to do before you can actually have a private practice. If you're interested in psychological practice, you could earn a master's degree, a PhD, or a PsyD. And we're going to talk about a little bit about on this page about what the differences are between the three, the advantages, why you do one over another. However, if you're really interested in psychological practice and which one is the best route for you, I suggest you join some of our Psi Beta meetings. You don't have to be a member. I'm currently co-advisor, but often we have guest speakers, and I will announce those throughout the semester that really helps students better understand what these different pathways are and helps them to choose one that maybe is more appropriate for them. So many graduate programs in psychology offer the option to earn a master's degree in 2 to 2.5 years. This degree prepares students to meet the requirements for an MFCC, which is a Marriage, Family, Child Counseling degree, LMFT, which is Marriage and Family Therapy License, or an LPCC, which is a license for professional clinical counselors. So these programs prepare individuals to work in private practice, community agency settings, and the like to provide counseling services for adults, children, families, and couples. This licensing component, there is a licensing component that's required before you can start seeing patients on your own. So typically when you earn one of these degrees, you then have a set number of hours that you have to work under somebody who already has this degree, and they supervise you. Typically you're seeing your own patients, but because they're supervising you and you meet with them, I'm not sure how often, maybe once a week or so, they actually get some of that income from those patients that you're seeing. And then there's also a test that you have to complete. PhDs and PsyDs are doctoral degrees. So a PhD is a doctorate of philosophy, And both PhDs and PhDs are doctoral degrees that allow you to diagnose and to treat severe mental disorders. Whereas a master's degree, when you're an MFCC, LMFT, or LPCC, you're dealing more with family issues, maybe some anxiety issues. I have a friend who worked in an eating disorder clinic, but the severe mental disorders really need to be treated by a PhD or a PsyD individual. So both can take anywhere from 4 to 6 years. Both will involve clinical hours, licensing to practice. The PhD focuses more on research and it's considered a doctorate in philosophy. So there is a research dissertation that you have to do, but when you're done, you're trained to do both research and be a therapist. Now the PsyD is a doctorate in psychology, and the PsyD is going to emphasize the clinical aspects more than research. So you're going to do a lot more practicums, a lot more clinical type of work, and the research takes a back burner. You'll do some sort of literature review most of the time, but you won't actually learn the research process. But again, they are also able to diagnose and treat mental disorders once they graduate and do their clinical hours and their licensing and all that kind of stuff. So now you may wonder, where does a psychiatrist fit in all this? Well, psychiatrist actually is an MD, a medical doctor. So they go to medical school, which is different than, graduate school where you're getting a master's, a PhD, or a PsyD. So MDs, psychiatrists, are in medical school. They are medical doctors, and they have chosen the path of psychiatry. So they have to do all the same things that another medical doctor would have to do in terms of their education and then their post-education pathway. But they are also trained to diagnose and treat mental disorders. However, because of that medical background, most psychiatrists adhere to more of a biological perspective, and their main job is kind of prescribing drugs for these severe mental disorders. There are also many areas outside of academic settings and therapy for psychologists. Some may require advanced degrees, while others may not. So it's beyond our time together to cover all of them, but I'm happy to talk with anybody who's interested or would like more information on what you can do with a degree in psychology, with or without an advanced degree. So I have a variety of different things listed here, from sports to advertising to public policy, military training. Here you see a police officer using operant conditioning and classical conditioning to train a dog. This color and motion guide is used by advertisers to help market their products. So there's a variety of ways that psychology is implemented in many different fields. And many people with a degree in psychology don't end up going on to graduate school, but still use that psychology degree to their advantage.